Hi everyone, welcome to the Growth Paramedic channel. This is the Pharmacology class, and today we are going to be covering Glyceryl Trinitrate, also known as GNT. So let me just write that down. Before we begin, I'll just do my quick disclaimer. So this channel is for educational purposes only and it's not intended as medical advice. Whilst I always strive for 100% accuracy, errors may occur and medications and protocols do change over time. So please do not solely rely on information provided on this channel, but as additional reinforcement to your learning at paramedic school. Okay, perfect. Now that we got that out of the way, we're going to go back to the same format that we've done in the previous pharmacology classes. And that's simply, we're going to be covering glyceryl trinitrate in three areas, which is the definition of GNT. So what is GNT and what is it used for in the pre-hospital setting? And then we're going to cover the pharmacodynamics. As I mentioned in previous videos, I won't go through the pharmacokinetics because that's not as relevant, because you're mainly looking at how the drug works in the body. If you guys want to know about the pharmacokinetics, then please do comment in the videos and I will add them into future videos, and if need be and there is enough interest, I may redo these videos and include the pharmacokinetics. So you have the definition, the pharmacodynamics, and some precautions that I want you to be aware of if you are going to be using this in the pre-hospital setting. All of these sections will be time-stamped. So if you're in a rush and you need to get to one area quickly, or if you're about to study or do an exam and you want to quickly get a refresh on glyceryl trinitrate pharmacodynamics, you can just quickly go to that section of the video and not watch the entire video itself. So they are going to be time-stamped, and this part was the introduction. And now that we got that out of the way, we're going to move straight into the definition of GNT. So definition of glyceryl glyceryl trinitrate. Now from here I'm going to be referring to it as GNT, as that's the most common way it's mentioned in the pre-hospital setting, as well as that I don't have to keep repeating that line over and over again. It does get a bit dull, unfortunately. So definition. So glyceryl trinitrate, to GNT, also referred to as GTN, is a nitroglyceride, glycerin. So that's a class of medication. And GTN is used in the pre-hospital field for the treatment of chest pain and high blood pressure. So I'm going to highlight that as well. These are the main two key components and effects it has, and why we use it in the pre-hospital field. So chest pain in cardiac arrest, in cardiac ACS patients, acute coronary syndrome, as well as that we also use GNT for patients who are going through autonomic dyslexia, which is a form of spinal cord injury. The reason for this, and I'll go through it more in the pharmacodynamics, is because it is a potent vasodilator. So it opens up the vessels and it decreases the blood pressure, hence why we use it for high blood pressure situations. And it has multiple forms that it can be administered. So multiple forms of administration. But the most common one that we use in the pre-hospital field as paramedics or EMTs is under the tongue. So that's the main one. There is a spray, but we generally have the tablet form that you put underneath the tongue, and that's referred to as sublingual. So we administer GNT sublingually. And sublingual is basically under the tongue. So that's a more fancy way of saying it. So that's it. That's mainly it for the definition. Not too long today. So let's head off to the pharmacodynamics then. Let's move on. So the pharmacodynamics. And just to reiterate, it's what the drug does to the body. So when you administer the drug, what is that drug then doing, and what things can happen if it is administered? So for morphine, we know that if we administer morphine to a patient, it reduces their sensation to pain. So it reduces pain for those patients. So now we need to know what GNT does to patients if we give it to them. So with the pharmacodynamics, as I just mentioned there in the definition, GTN is a potent vasodilator. And the reason why that's important is because it decreases preload in the heart. And it's done by, and there's three things I'm going to point out here. Increasing venous capacity in the peripheral veins. Let's see. It reduces. Actually, let's change the color of that. I think that's a little better if we do that. So it increases venous capacity in the peripheral veins, and it decreases or reduces ventricular filling pressure. Another point that it does is that it also, arrow down, decreases arterial blood pressure. And we're mainly talking about the afterload, not the preload. So just mention afterload. If you're not too sure what all this means, don't worry about it. You don't really need to understand all these 3 points. You just need to really nail down that it is a vasodilator, and you can explain it does this by these 3 things. So all these 3 things results in decrease in myocardial demand. So the actions of GNT in the preload causes decrease in myocardial demand, and that's what we want, especially with patients who have chest pain or who are going through STEMIs or myocardial ischemia. By decreasing that demand, you are benefiting the patient, and we'll kind of explain that in the next part. What happened here? Oh, I went a bit too low. Whoops. So let's go down to the next point. So GTN's interaction. So this is kind of a longer point now that I'm going to go through. So GTN's interaction and conversion to nitric oxide, and this is by mitochondria aldehyde dehydrogenase. Oh, there's always a tongue twister. Never really like saying that. But that's just one thing. To mitochondrial aldehyde dehydrogenase, and this is also known as MTALDH. But I don't expect you to really to know that. But basically, GTN's interaction conversion to this nitric oxide, which is done because of this really long word that I don't really want to pronounce again. So because of this, it is converted to nitric oxide, and this leads to, there's a few other steps here, but it eventually leads to the eventual dephosphorylation of the myosin light chain of smooth muscle or smooth muscles. So it's a chain by chain reaction here, and it is this, let's go down a bit more. So following from that, it is this chain reaction, or it is this dephosphorylation. So the key word here, dephosphorylation. It is this dephosphorylation that causes, and this is the really important point, everyone, relaxation. If I can spell it properly, relaxation and increase in blood flow in veins, arteries, and cardiac tissues. So as you can see from here, very important interaction and conversion that occurs. And this part, you just need to memorize it. You might need to read it a few times, but generally it's always a chain by step reaction. So when GTN is administered, it is converted to nitric oxide. And if you want to know what converts it to nitric oxide, it's the mitochondria aldehyde dehydrogenase. But you don't really need to know that long word. You just need to know that it converts to nitric oxide. And this new form, nitric oxide, leads to dephosphorylation. And this dephosphorylation then leads to relaxation, increase in blood flow to veins, arteries, and cardiac tissues. So from here, I don't have enough space. I might go to the next point here. Go all the way to the top. So from here, guys, the overall effect, as previously mentioned, and I'll put them down here, is a decreased work. I actually may even change the color. A decreased work of the heart. And this results in relief of anginal symptoms. And that is, so for symptoms, when I mean anginal, so a good example is chest pain. And from that, it's relief on anginal symptoms. It also increases blood flow to the myocardium. And this is particularly important if there's already signs of myocardial ischemia, and ischemia is basically self-death due to deprivation of oxygen in rich blood. In deprivation of oxygen-rich blood. So you'll know in the pathophysiology of acute coronary syndrome, like things such as atherosclerosis. When there's a plaque rupture or when there's a buildup of plaque, it can block the coronary vessels, and these vessels carry rich oxygen, oxygen-rich blood around the heart. So if the coronary vessels or arteries are blocked, these cells in the heart, these cardiac cells, are then not able to get the oxygen, and they start to starve and they die, and that's called ischemia. So by administering a GTN in patients that have this condition, it opens up the blood vessels by relaxing them. So we know about vasoconstriction and vasodilation. It causes vasodilation of the blood vessels. So if there's a blockage, by opening up that vessel, that blockage is then no longer blocking that area, which is what we want, because then the blockage part then can get the oxygen it needs before it dies. So that's the main point when it comes to the pharmacodynamics, is that it opens up the blood vessels, it opens up the vessels because of its relaxation effects. We'll head off now to the precautions part. Not too much today, but there are a few things I just want to mention if you are considering, or if you are going to administer GTN in the pre-hospital setting, and that's for patients who have a cerebral vascular disease. And I may cover this in the medical series, what it is, but if you know what it is, or if you don't know what it is, you can just research it. But essentially, the reason why you gotta be precautious in this instance is that if there is an increase in intracranial pressure, no, I didn't spell that right. Intracranial pressure, so ICP, it may cause unexpected stress on weakened vessel walls. And because of this can lead to a greater risk of aneurysm, rupture. So that's just the main thing. If you're giving this GTN to a patient with cerebral vascular disease, that can bring the risk of increased ICP, and that then increases the risk of aneurysms and aneurysm ruptures. Just another point when it comes to precautions is, I don't know if the mic's still moving, there we go, is the risk of hypertension and syncope. So you got to be mindful, if you're giving this to a patient that already has a low blood pressure, administering GTN will lower that blood pressure, and you don't want to be lowering the blood pressure below. So you know the normal range is about 100 to 120, and if the blood pressure is dropping down to the 80s and 70s, generally that's not enough for good perfusion of the body. And again, if you do that, that can run the risk of syncope, because there's simply not enough blood flow around the brain. So just be mindful that the blood pressure is adequate. You might need to set up an IV and get some compound sodium lactate or some Hartmann's in. But at the same time, I think most protocols in the ambulance services state that the patients, if you're going to give GNT, need to have a blood pressure greater than 90. Or if the blood pressure is below 90, you can't administer GTN. So just be mindful of the hypertension it can cause and the syncope. And as well as that last one, and this is more to do with its the effects it has on the cardiac cells in terms of the smooth muscles when it comes to relaxation, is suspected inferior myocardial infarction. Actually, I should have inferior highlighted as well in red, because that's just, they're together. So suspected inferior myocardial infarction, but only, in this case, only if right ventricle is involved. And the reason for this is because cardiac output in right ventricle myocardial infarction, or MI, is heavily preload dependent. So as you know about the effects of the afterload, if you reduce the afterload, it affects the preload. So you got to be mindful of that, especially if there are signs of right ventricle involvement in an inferior myocardial infarction, and that's more of an advanced level, and I won't go through identifying that. I may do that in the ECG Mastery series, but for this one we're mainly concerned about the pharmacodynamics and just some general precautions. Anyway, that ends it for this session. Hope you guys learned something about glyceryl trinitrate, and yeah, I'll see you next time. Thank you.